Hello, everyone. This is Carol Buller, and I do apologize for the slight delay. I think I'm all together now. My computer went blank, and a glass of water fell off my stand, so I was in a little bit of hurt for a moment there. So today is a good day to talk about hope, help, and humor with that start for myself. And I'm going to tell you a little bit about myself and then why I picked this topic. First of all, I can't say that I actually am the author of these three words. Robert A. Stern, a PhD at Boston University School of Medicine, was one of my daughter's faculty. And he used this in one of his lectures on dementia. So thank you for that. So a little bit about me. I'm a nurse practitioner. I've specialized in caring for older adults for my entire career. And for the last 30 years, I've worked primarily with persons who have dementia, but also with people as they age. I'm a nurse practitioner. I'm a daughter. I'm a wife and a mother and grandmother of a soon-to-be 3-year-old and a 6-month-old. I've been an educator at KU School of Nursing, teaching in the Adult-Gerontology Nurse Practitioner program. I'm a musician, a gardener, a mentor. I'm also a reader and an early morning walker. And I am at risk for developing Alzheimer's disease and dementia. So I really am looking for ways that I can share the things that I've learned through the years in taking care of this really important group of people. So first of all, I want to share a little bit about my dad. My father developed Alzheimer's type dementia. He had a variant of aphasia. And so he had been a minister, pastor, and words were his ability to communicate with people, giving sermons, praying, participating in sacraments, things like that. And as his Alzheimer's continued, he actually lost his words. And in his final year of life, he moved to the long-term care facility. And even though he couldn't speak, he would go into people's rooms, hold their hands, and offer them a blessing. And in the final days of his life, he had no words, but he was still certainly had this spirit of compassion. So he taught me a lot about that, and also about being a family caregiver too. So because I have these risk factors, because I've been hanging out with a lot of people who have dementia over the years, I still have hope. And I have hope because there's increased awareness in Alzheimer's disease and what that means to families. There have been an increase in research initiatives directed toward the prevention and treatment of Alzheimer's disease. And I can say that for sure, because in the last 30 years that I've been in practice, the research initiatives have increased dramatically. And we have improved care for persons with dementia, Alzheimer's disease, cognitive impairment, and their families. And there is a focus on more earlier diagnosis and being more transparent and talking about the experience of having the disease as well. Hope is knowing that there is help and support available, that there are many educational opportunities and resources such as My Alliance, and that there are ongoing research efforts that many of us participate in and that you can participate in as well. And that there's increased federal research funding. Just in the last year, there was an increased allocation from Congress for research related to dementia and Alzheimer's disease prevention and treatment. So we really have the opportunity to be part of research trials and to also learn because being part of a research trial when you're healthy or when you're in early dementia helps us learn how the brain changes in healthy aging and with Alzheimer's disease. And there's hope that the brain can change. And we learn that the brain is not a static organ, that it has the ability to maintain or improve cognition, and that we can do that by exercising the brain. Now, you don't have to do crossword puzzles if you don't like to do crossword puzzles, and that would be me. But just doing different things and reading and exercising your brain in other ways can help maintain its plasticity or neuroplasticity. And the brain can change in response to cognitive engagement. And there's also hope because we know that there's certain things that can help prevent or reduce the risk of Alzheimer's disease. So those are called protective factors. And we want to look as healthcare providers, but also as consumers, for reducing the risk of hypertension or hyperlipidemia, reducing the risk for diabetes, and also for traumatic brain injury. And then also, if we have those illnesses or if we're treating someone with those, to really treat those so that those risk factors for further decline in cognitive impairment, but also preventing the risk of further heart disease, kidney disease, and such. We as providers can help with that too. Help are things that we can do. And this is one of the exercise prescriptions that I would give to many of my older adults. It's easy to say it's important to engage in physical activity, but what does that mean? So finding something, 20 to 30 minutes of physical activity on most days of the week. 4 days should be aerobic exercise. 2 of those days should include strength and resistance training, and 1 day includes balance and stretching. So for me, as a younger, older adult in a geriatric practice, I go walking every day for 30 to 45 minutes. And then 2 days a week, strength and resistance training, and then almost every day yoga for balance and stretching. We need to continue to look at food to support our brain health. The dark green, the leafy vegetables, the oranges, eating the color wheel is one way of looking at it. And I learned about the MIND diet years ago, but this may be continued one of those things to continue to use when you're looking at making choices to eat healthier foods, such as the green leafy vegetables and berries, nuts and whole grains, eating fish, at least 1 serving a week, looking at beans and lentils and soybeans, and poultry, using olive oil instead of some of the other oils, and possibly drinking wine 1 day a week. And then, of course, eating less of these foods, such as butter and margarine, cheese, red meats, deli meats, and pastries and sweets. As you look at this is kind of the American diet. And to be able to reduce some of those will be very helpful for the brain. I may not have the latest research evidence on this, but there's been some evidence that drinking red wine in moderation, like less than 1 drink a day, may help decrease the risk of dementia or cognitive impairment. But more than moderate drinking does increase the risk. And so I would tell my older adult clients in my primary care practice that for women, it's no more than 1 alcoholic beverage a day. And we would look at the size of that. Wine would be 4 ounces. And for men, it would be no more than 2 drinks a day. More than moderate drinking with older adults can increase risk of dementia and memory and cognitive impairments. And in a person who does have cognitive impairment, continued drinking also increases that risk. Another thing that is very helpful is to continue that social engagement. So if you're a person who is active and can volunteer, doing that is important. Maybe taking a class or discussing a book or joining a support group. If you're a family caregiver, keeping up with friends, because these social interactions may help prevent dementia. A couple of things that I found with some of my clients were that they were very, when they were developing early dementia and even further, they were very upfront about talking about that. And they would say that they did have dementia or they had Alzheimer's disease. And they talked early on about what would help them. I was on an airplane this week and sat next to a woman, and she said to me, I'm deaf in the right ear, so if you need to get a hold of me, just tap me because I won't be able to hear a thing. Well, I thought to myself, that's something that if I had Alzheimer's disease, would I be able to say to my friends? And I think I would. I'd say, I'm not remembering as well, so I'm going to need some extra help and guidance at times. I may ask those questions again. So I think it's really important to seek those people out who can help be part of your peer group and support you. We also know that trying new things and learning something new is important. Doing things like even doing a familiar task backward, or instead of driving the same way to work, go a different way. Maybe taking up a new language, or trying a new recipe, or reading a different type of book, or starting a new hobby, or rekindling an old one too. For me, I'm a musician, so it's continuing to play the piano, but learning some different music as well. There is also benefit in spiritual health and looking at different ways to calm that anxiety or calm the spirit, especially when you're a caregiver or when you're in a difficult situation with a family member. And so thinking about these short bursts of meditation or just breathing and self-calming exercises can be really helpful when your family member is not cooperating, or when you're in a situation with your mother-in-law who has dementia and is not able to think like she used to. Being able to breathe in and out is helpful. I used to do this breathing technique sometimes with patients who were sometimes difficult, but before I would go in, taking a deep breath in for me and then breathing out for that person to help calm them as well. Self-compassion is so important, recognizing that you may be in a situation that is really hard, and taking care of yourself is one of the important things to do as a caregiver, or if it's a provider and you're taking care of many people that are drawing on your abilities, to also have that self-compassion. People talk a lot about mindfulness, but mindfulness is simply being in that moment, being in the awareness. And sometimes breathing can help with that, as well as prayer and a sense of gratitude practice. I found that practicing all of these things has certainly helped me to calm myself as well, so that dropping a glass of water and having your computer go black is not as stressful as it would have been 5 years ago. I know you had a session on sleep last week, so just aiming for those 7 to 8 hours and avoiding the sleep aids, especially things like Benadryl that you can buy over the counter, because those medications tend to cause more difficulty with cognitive function too. And then treating things like sleep apnea and restless legs and depression, talking to your provider about those. So memory boosting activities include those stress reduction techniques and keeping well hydrated, avoiding multitasking, and then focus on what you want to remember. A lot of people use that diary or appointment book or put it on their smartphone with reminders. It's important to assign specific places for important items. And I know that as I'm getting older, I have to always put my keys in the same place, otherwise it'll take me longer to find them. If you have difficulty with names, know that that's just a common thing. But it's helpful to associate names with a noticeable feature about the person as well. I learned that if you didn't remember names when you were younger, you're probably not going to remember them as well when you're older too. So just accept that. And also know that certain medications can affect memory, so it's important to have a healthcare provider or a pharmacist review medications periodically. And then, of course, um, work with healthcare provider and resources to manage those health conditions that can help uh, actually lead to cognitive impairment or make that worse too. So I know that there are so many more resources than there were in the past, but resources with the Alzheimer's Association and support groups, the Area Agency on Aging for local resources, social work, uh, social works resources in these organizations, as well as with your provider or healthcare professional in the medical groups as well. And then finally, humor. You know, life is really funny at times, and life is funny, especially when you can't remember certain things too. And while I don't know all the scientific benefits of laughing, I do know that it helps me. And in rounding with my patients or in working with them, I always try to find the things that we could smile about together, that we could laugh about together, because that helped me make it through my day, but it also helped forge a connection between us as well. So thinking about laughter and laughter therapies, important to, you know, watch those funny movies that you might have watched years ago, or read funny books or comics or jokes. I know my father had a collection of writers that wrote poetry that was humorous. He also had a collection of short stories that was very humorous. And he spent time reading about those too, even as he was having more difficulty with organizing his own thoughts. For my own self, hanging out with children is one way to make me laugh. And so I am thankful that I live actually right below my two grandchildren in our own house, but they live above us. And then the other thing would be improvisation. Years ago, I listened to a podcast that really interested me because it was about a woman talking about how her mother-in-law had moved in with her and her husband, and her mother had dementia and was in a situation where the daughter couldn't seem to relate to her, and the mother was very angry at the daughter. The daughter was having trouble with those caregiving things that had to happen. But she noticed that her husband could get her mother to do anything. And so they were sitting out on the back porch, and she was listening to her husband, and they were just going off. And, the mother would provide a cue, and the husband would just improvise. He didn't try and reorient her, and he didn't try to say that she was wrong about this, and he didn't try and change the subject, but he just crossed the street to where she was at. Well, I found that that was one of the techniques that served me well, especially when I was working in a dementia unit, when I was rounding on patients, was really crossing the street and finding out where persons were at. And if they were anxious and upset about things, or if they were tearful, finding out what that was about. And often it was related to a memory years back. One woman that I met was very anxious about losing pictures. She was always concerned about losing pictures, and she actually blamed her husband for losing the pictures. Years later, or this was quite a bit later, when she was in the process of end of life, and I was talking with her family, and I was being with her, and I said, I was wondering about the loss of pictures, because that was always something that was really important to her. And found out that at one point in time, they had a fire in their house and they lost all those family pictures. And because the family pictures were consumed in the fire. And that was a memory that was so vivid to her, that kept coming up and causing such concern for her. So I found that's important to go back in that memory too. So my mom has dementia, and the last 3 years haven't been good for her. She's 92 now, and being isolated in COVID we've really seen the effect on her memory. She lives in a long-term care facility. She has her own room, as does everyone else. And they're in these pods, and they walk to the dining room now. And she frequently tells me that she feels like she's on a train and they're going somewhere, but she just doesn't know where they're going. Um, and they're in these little pods, and then they go to the dining car. And it's such a real memory for her. Well, my mother grew up in India as a child, and she had to go to boarding school, or had to go to boarding school in the hills. And so it was a 3-day trip by train. And in those trains, they had these little compartments that you stayed in, and you walked to the dining hall, and you were there with a number of people in that same compartment. And so in the process of learning about that memory, we go back and we talk about other things that she remembers about that experience. We talk about, the food that she was eating on the train and things like that. And we also talk about how, just bringing that back there, that where she is now. And it's always hard for her to remember where she is now, but she can certainly go back and remember those memories about when she was a young child, an adolescent, and a young adult too. So finally, I think that incorporating hope in your task as a family caregiver or as a healthcare provider, providing the help that's needed, and tempering it with a great dose of humor, and seeing that even in light of this cognitive impairment and Alzheimer's disease and some of the changes that occur, that there is reason, again, to have hope, and there's reason to get help, and there's lots of reasons to enjoy humor and laughing together. So this was me and my dad on really the final Christmas that he was alive. And he certainly guides me has guided me in my practice as a practitioner too. So that's all for me.
Thank you very much. We appreciate that wonderful presentation that you gave. So we can go on ahead and turn it over for questions at this point.
Actually, I'm going back here to Lloyd, and he talked about wine. And if I said it's one wine per day, or one drink a day versus one drink a week. And I'm sorry, I was freezing. Okay.
Are there any other questions? Go ahead.
Yeah. And to Faith, my mom went to Woodstock school in India.
All right. Any other questions? Last call here. Oh, here comes a couple of questions.
Weather causing brain fog? Who knows? I mean, weather does affect us.
It looks like there was another question from Cheryl. I don't know if you were able to address that one.
Oh, here. Cheryl asks, how are you preparing your family for a possible diagnosis? Okay. So yeah, that's a good point, because I have to say that my family grew up with a mother who was a geriatric nurse practitioner and grandparents who had dementia, and so they're aware of what happens. My daughter is a geriatrician, and we recently moved to Boston because 2 out of our 3 children and their families live in Boston. And one of those was because my son-in-law, who is my favorite son-in-law and my only son-in-law, told us that they wanted to take care of us as we got older. So it's kind of a relationship that we've developed together. So I'm hoping that I can stay cognitively intact for a long time. But we've talked about that in other ways too. I was also the mother who talked about advanced care planning with my teenage children when they were in their 14 and 15 years of age. So probably, we talk about a lot of things. Okay.
Looks like we had one more question.
Okay.
Or two more questions again. So which is it? One drink a day or one a week? And it sounded like, from what I understood,
Yeah, we said one a day.
Mm-hmm. Okay. And then there's another question in there for Richard. You want to take that one?
I would not. I think that the APOE gene that may or may not, I mean, it does not necessarily mean that a person will get dementia. And you can develop Alzheimer's disease without that gene. So I think that might be up to them. But at this point, I don't know that it's something that we're using to look for risk yet.
Okay.
Any other questions? Yeah.
All right. Well, if there aren't any more questions, we will go on ahead and wrap up for today. Again, thank you, Dr. Buller, for an outstanding presentation, and thank you everyone for joining us. Just as a reminder, we have a new weekly webinar presentation next Thursday at 2 p.m. as well. So look out for that information in your My Alliance Monday email. Or you can go to our website at kualzheimers.org, and I will put that in the chat for everyone, so you don't have to worry about writing that down. Also, the presentation recording will be available on our YouTube channel shortly, which you can find by navigating our website under weekly webinars or by using the link in the reminder email. If you have any questions or comments in the meantime, feel free to email myalliance@kumc.edu. We hope to see you next week. So thank you, everyone. Oh, it looks like we might have had one more question here. If we want to go ahead and take that one.
Sure. I think it's just if my father definitely had Alzheimer's disease. My mother has dementia, has not been formally diagnosed, but it doesn't matter at age 92. We treat the symptoms, and she's been on some medication related to that, and that has actually helped. So she likely has that as well.
All right. Well, again, thank you very much. We appreciate it. And everyone have a lovely week and weekend. Thank you.
Thank you very much.